Hi, Dan Smith, Director of Sports and Spinal Physio here. So over the past 10 years, I've seen approximately 2,000 patients with headache and migraine, and my colleagues and staff have seen a similar amount. Now, one of the questions we get asked by our patients coming in with headache and migraine is, if the pain's in my head, why is it coming from my neck? And this is a really good question because a lot of patients don't actually have any symptoms in their neck. They feel it all in their face or in their head. So before we answer that question, let's just talk a bit about the kind of symptoms that patients will describe when they come in with headache and migraine. Now, a headache can be an all-over headache, it can be a headache across the forehead, it can be a headache at the back, it can be one-sided, it can be over the temple, it can be in the eye, it can even be in the jaw and the ear. And this is because the neck, the top part of the neck here, has the ability to refer its pain up and over in these areas. So we classically see a C2 headache, a C2-3 headache, sorry, coming up and over here. We often see a C1 headache being across the forehead. So what actually happens in this scenario is that these joints become stiff and strain starts to occur. You then get changes within the muscle, so muscle tension and muscle spasm occurring, and all of this leads to the person experiencing a headache. Now, if this process sensitizes the brainstem, which is quite close to the upper neck, it can then cause migraine symptoms as well, and that might include nausea, vomiting, dizziness, sensitivity to light or sound as well. So these are all common problems that we see in our patient headaches and migraines that are often attributed to problems within the upper neck. Now, how do we treat this? So we carry out a thorough assessment, and what we look at is how the upper neck is functioning. We look at stiffness and mobility, we look at posture, we look at movements, and we address these things with a structured treatment program that aims to restore the normal glide at the joints, settle down the spasm, and address the environmental factors that are driving this as well, which might be something like workstation ergonomics or something you're doing at home that's causing it. And once we've done this, quite often we find the patients' headaches and migraines are a lot better or completely gone. In fact, we've had lots of patients who've had a headache or migraine for 30 years, and a course of treatment has resolved it and the headaches haven't come back again. So we know that this treatment works. So if you've got a headache or a migraine, but you haven't got any neck pain, and you've seen your doctor and he says there's nothing that can be done for it, then please get in touch, because quite often the symptoms will be in the head, but you won't feel it in the neck. And in the event that you come to see us and actually we can't help you, we work very closely with two top neurologists that specialise in headache and migraine, so we can always refer you on to them for a second opinion or some input from their end if needed. So if you've enjoyed this video, please share it with your friends and family. And if you want to know more information about headaches and migraines, we have a fact sheet that we give our patients that we're quite happy to send you via email. So if you just get in touch with via Facebook, private message us, we will get back in touch with you and send that fact sheet to you. In the meantime, this is Dan Smith, Director of Sports and Spinal Physio.